Hey, Dad.
Oh, I was just looking for you.
So one thing to note, right? One, I wasn't put in a waiting room. I don't know if, and two, I'm muted upon entry, but it doesn't, I can unmute myself. I don't know if that's what you want.
I thought no, that's not what I want. So how do I do that then?
I don't know. We'll have to figure it out. Can you make me, I mean,
Can I share the screen or?
no, I mean, sure, but like, let me look.
Because that's what I thought I had done, obviously. It's recording.
I know we're recording. Do you really want to record this part of the conversation?
All right. I don't want to start and stop it.
So, okay, look at
Yeah.
manage participants at the bottom.
Where do I see more reactions?
Do you see participants?
No. Oh, yes.
If you click that, is there something that says something like manage participants?
Okay, hold on a second.
Can you also make me an admin? If you hover over my face, you should be able to see 3 dots that then, if you click that, there should be an option to make me an admin.
Mute, stop, rename, spotlight. Allow to put in rename, pin, spotlight for everybody. Make host.
Yeah, make me a host. Well, no, don't make me the host. I don't want to be the full host.
Okay, so how do I
make me an admin? What can you say again what the options are?
Sure. Mute, stop video, chat, rename, pin, spotlight for everyone, make host, allow to record, allow to multi-pin, remove, put in waiting room.
There can only be one host.
Okay. So I'll hover.
So don't make me the host. Do not make me.
Okay, that's all right.
No, but I can't help you with anything if I don't have admin privileges.
Okay, so I'm just trying to figure it out. Okay. Manage participants. Nope. So not sure.
So I think it's within your account to make a co-host, you'll have to select something else. Let's not do that right now, but well, or we can do it because otherwise I can't.
Okay, so shall we do that?
Sure. So if you, can I just send you the thing on how to do it?
Sure.
Or I can read it to you. What would you prefer?
Yeah, why don't you read it to me?
Okay, so sign into your Zoom and your account settings and go to your account settings.
Okay. Okay.
Hi, Norbert.
Hi.
And go to the meetings tab and there should be a co-host option.
Okay, I'm looking at meetings now. Unfortunately, because I'm in the meeting, maybe I should just stop the meeting.
Don't stop the meeting.
Okay, because I can't get into. Beanie? Okay, so would you say account management? Go ahead.
Under account settings, go to the meeting tab, and there should be an option that says co-host, that it should be toggled to say on so that you can make me a co-host. You know, it's like one of those little things that you can toggle, you know what I mean?
I'm in account management.
Not account management, account settings, the meetings tab, and then the co-host option.
Tab. I see security, schedule meeting, in meeting advance, calendar, and context, email notification, admin options.
Let me look at mine to see if I see
Okay,
this.
the most important thing I need to do, well, I guess to make you, allow you to think is there's a way that I can mute people. Otherwise, that's a
You
problem.
can mute people and unmute people. The point is right now people can unmute themselves just like I did. And
Right,
just
but I want to mute, I don't want them to be at all. That was what.
okay. So then under participants, do you see something that says something like manage participants?
Unfortunately, under participants, I don't see that.
Or do you just overall see something that says more in the participants panel? And then if you see, if it's selected, mute participants on entry, then a pop-up window should appear
I
according
don't
to
see
this
it at
thing.
all. Yeah. I guess we should just get you to be a co-host and then you can help with me.
You don't see something that says at the bottom.
I see participants, and when I
and then-
right click
and
or
if you
left
click
click,
that, do you see a panel on the right with the list of names?
I see invite. I see invite. There's nothing else that comes up.
At the bottom. Can you screen share what you have?
So one participant can share at a time. How do I do that?
If you just hit screen share,
I did.
then a window should come up of what you want to screen share and you select what you want to screen share.
Okay, share.
Okay, so now go to the Zoom meeting.
Go to the Zoom meeting.
Like you're sharing this sort
Yeah.
of overall account page here.
Yeah.
Just let's go back to the video call, like.
Okay.
Like, so click at the bottom, Dad, where you see all the icons, click the blue one with the white video camera in it. That's the Zoom icon. At the bottom toolbar. Yeah, the very bottom of your computer. There, where your cursor is now.
Okay. Yeah.
No, not there. Go. Like right now, Chrome is selected, like the total bottom.
Okay. Now what? Rena?
No, I'm saying you have to select.
Okay,
something
you're gonna
else.
just have to come over here, Rena.
I can't come up. You want me to
You're gonna
come
just,
over?
yes, you're gonna have to come over.
Just wear a mask.
Just wear a mask.
So I'm not going to be able to see it on my computer because I don't have a link, unless the link was sent earlier before I was registered. So then I should wear a mask too.
Could you open the door, please?
What?
Nothing.
I'm not.
All right, go ahead. Bye, Rena. Okay.
So like this is how we get to Zoom, right? Like these are
Okay.
the icons. So now let's see if we can figure
Take your time.
it out. I'm taking my time.
Mute all.
I got it, Dad. So they now cannot unmute themselves, okay?
Good. Right.
And then is there anything else that we need?
I want to be able to co-host Kate Lorig, Heba.
Okay, so we have to do that in your settings to enable you to make people co-hosts.
Okay. Or I need to be able to switch over to them. They don't have to be co-hosts.
Do you want them to be able to like screen share, for example?
Yeah.
So that means that, let's stop screen sharing, right? We don't need people to watch this. Just see something. Okay, so right now only the host can screen share.
Okay.
It's either only the host
Okay,
or
so-
all
Well, we're not
participants.
going to do that. So how do I hand it back? Hand it to, for example, Kate Lorig or Mohammed or whatever.
I think that, I'm not sure because
If
you
I wanna
don't
have
really want
somebody
to
else-
make them the host.
Okay,
You know what I
so-
mean?
So I can tell, that's okay. That's no problem. No problem,
Yeah.
because I have.
And then you have to unmute them. So maybe let's try it with me because right now they can't unmute themselves.
Okay.
So let's try it with me that you can unmute me. Okay.
It says ask to unmute when I hover over them.
Well, give me a second. Let me just.
So I'm gonna. Oh, just to the group of people. All right, so what we're gonna do is I'm going to unmute the presenters. Everybody's on, Nihad, Heba, Mohammed, and Kate. So it's good to see you all. And I'll unmute you in just a minute. You all have the timeline. So I will start, then I will hand it over to Nihad. Nihad, one thing you need to know is that I'm going to have to show the slides. I will show the slides. So I've got the slides, not to worry. And you'll just tell me which ones you want to see next. I'm assuming if Kate, you want me to show any slides, you're going to have to send them to me. I haven't unmuted you yet, but I will in just a minute. And I'm assuming that Hebas doesn't have any slides and Mohammed doesn't have any slides. Are you on yet?
So I can't unmute myself. That's good.
Ask to unmute.
Success. Okay.
Nihad, do you have any questions for me?
And for her to be able to speak, you have to, again.
You have to go.
It's fine. I just turned off my audio. But does that make sense, Dad? She is, it's a one-time only thing. There you go. Yeah.
Hi, no, did you say, I didn't hear anything. I don't have any questions. We're all set to go, Mohammed and I.
Okay.
Did they hear about the screen sharing? Were you unmuted then?
Yeah, did you hear Nihad?
Yes,
Oh, you did, okay.
I did, but I'm going to be on video for just a bit, but then I'm going to get off because the internet here sometimes is weak. So I'll stay on for a few minutes before I get off the video.
And do you have any questions, Kate?
I would suggest that you get a lamp by your computer. Your face is totally dark in the screen.
Okay, thank you.
Um,
I'm
and
nothing
you-
to look at, but it's okay.
And you can leave me unmuted throughout the entire presentation because I can mute my mic.
Okay, all right. And
Good morning, Mohammed.
I think Mohammed wants to say. So I'm reading Mohammed.
can you hear me, Mohammed?
Okay, thank you so much. I was muted.
Okay. You have any questions?
No, thank you. I am ready.
Okay, all right, very good. So we'll start in 2 minutes. And it's a pleasure to see everybody, people who I know and people who I don't know. Can you see my face now, Kate?
It's a little better, but not much. Is there any way you can get a lamp?
Yeah, I'll try. Okay.
Yeah.
How's that?
Yeah, that's a little better.
Okay.
Not great, but a little better.
As Nihad knows, I'm nothing to look at, so it's okay. and many of others of you who are on the phone.
Nihad is muted. She wants to speak, I guess.
I guess I can't mute myself. If I mute myself, it looks like Norbert, then I stay unmuted. I stay muted, so,
Right, so why don't you just stay,
okay.
okay?
Hey, green light a minute ago. What happened to it?
My name's Norbert Goldfield, and it's a pleasure to see many of you on the, well, it's a pleasure to see all of you, but there'll be many more who will be coming. There are, in fact, many of you here, more than ever that we've had since we started these webinars back in March. I'm going to just give a brief introduction in terms of practicalities, then talk a little bit about healing across the divides, and then we'll be underway. So just in terms of practicalities, everyone except for the speakers will be on mute. If you have any difficulty with the webinar, please use the chat box. I expect that the discussion that you will hear today will last about 40 minutes, and that will leave enough time for questions and comments. My name is Norbert Goldfield, and I'm the founder and executive director of Healing Across the Divides. And I just want to say that by way of background, All Americans, whether we like it or not, are involved in the Middle East and the Israeli-Palestinian conflict. 16 years ago, I chose to face that challenge and create something positive that builds on my healthcare background. And that is Healing Across the Divides, or HATD. HATD is a 16-year-old American nonprofit that's based on a simple idea. All human beings desire better health. The mission of Healing Across the Divides has remained the same in the entire 16 years of our existence. That is to say, we aim to measurably improve the health as an American 501c3 of marginalized Israelis and Palestinians through community-based interventions. How do we do that? We do that with amazing staff, some of whom you'll see today, and one of whom you'll hear from today. We have staff in both Israel and in the Palestinian territories. We have Marganit Ophir Gutler in Israel and Nihad Fatah in the Palestinian territories. And you'll be hearing from Nihad shortly. What are some of the kinds of efforts that we do that we fund? So we fund and provide technical advice. So for example, we're funding a joint urban farm between Israeli Bedouin and marginalized Israeli Jews in southern Israel. The outcomes that we're looking for are improved nutrition and improved communication. We're also funding a drama therapy intervention in the West Bank. And that's looking at women in particular who have suffered both from domestic violence and issues and challenges from settlers. We've also funded an intervention to improve mammography rates among ultra-Orthodox Jewish women. And another example, which we're going to be highlighting today, is looking at issues of the fact that Palestinians living in the West Bank and Gaza have high rates of diabetes, obesity, with little access to treatment. That's today's focus. In our 16 years of existence, we have measurably improved the health of over 200,000 individuals. We do it through these community-based groups that we fund, and we work with them to improve their effectiveness and efficiency through 3-year grants. As I already indicated, one of our outstanding representatives is Nihad Fatah, and I'm now going to hand it over to her. And it's a joy to see you on the Zoom, Nihad, and she will start working and introducing some of the work that we're doing in the West Bank with respect to diabetes and obesity. Nihad?
Hi, my name is Nihad Fatah. Thank you for the wonderful introduction, Norbert. That was very sweet. I've been working with HATD now for 4 years as the West Bank / Palestinian representative. I've to date have managed 6 different grantees in the 4 years that I've been working here. I moved to Palestine from San Francisco about 20 years ago. I'm married and have 3 boys living in Ramallah, in a small village outside of Ramallah. And I am very, very honored to be a part of HATD and the work that we do. And as Norbert said, I will be today highlighting the Stanford Chronic Disease Self-Management Program that we are implementing currently in Gaza with Diabetes Palestine, and the work that they do there is amazing. Currently, they're working with 150 beneficiaries, and there are about 10 group leaders who are young youth who are also type 1 diabetics. And we are working on the Stanford program where we're teaching these young people how to manage their chronic disease by eating healthy, exercising, and by addressing any psychosocial issues that they may have. We are also doing this with 2 other groups currently, and I will talk about them later on. We have a photo slideshow that I will be presenting. But in the meantime, what I'd like to do is introduce Mohammed Seyam, who is, hi Mohammed, who is one of the leaders and beneficiaries of Diabetes Palestine. And we will be doing a question and answer kind of. I will be asking Mohammed a series of questions right now, and he will be addressing the questions. But in the meantime, I am going to get off video because my internet is just not that strong. And so I think I need to do that. But I will start in a second, and I will start with my first question to Mohammed. Marhaba, Mohammed.
مرحبا.
All right, so our first question to Mohammed is, can you tell us a little bit about yourself and your family, and when you were first diagnosed with diabetes and how diabetes has impacted your life?
Okay, thank you, first of all, Yani, thank you, Nihad, for the brief introduction. Hi, everybody. My name is Mohammed Seyam. I'm from Gaza, Palestine. I'm a 21-year-old medical student. I study medicine here in Gaza. I am the young leader in diabetes. I represent Palestine in the International Diabetes Federation. I do a lot of extracurricular activities at my university. We all know that medicine is not only by certificate, so we need to do a lot of extracurricular activities. So currently, I'm the vice president for external affairs at the International Federation of Medical Student Association, Gaza local committee. And yeah, I've been diagnosed with type 1 diabetes since February 2011. So it's almost 10 years right now. And it's kind of a similar story as anybody would tell, any boy would tell, especially in the Arab region. It started very hard. It started as a complicated story. Like, of course, I was a kid. I didn't know how to act. I didn't know how to do anything regarding diabetes. Neither did my family. But I believe that my grandpa, who was diagnosed with type 2 diabetes a few years before my diagnosis, and who was on insulin therapy, had a little bit to tell about diabetes since he has his own experience. Diabetes did affect my life, of course, just like anybody else would tell. But for me, it did affect my life in a positive way. I used to complain about my diabetes when I was younger, but now, since I entered med school, now I'm a fifth-year medical student, so it's almost 5 years. So throughout the last 4 years, I don't believe I complained a lot about my diabetes. I've been doing very well. So me and my diabetes are kind of friends, just like what endocrinologists would advise us to have a relationship with diabetes. And yeah, this is simply me and myself and diabetes. This is a brief introduction.
Thank you. So my next question is, what's it like to live, to be a diabetic in Gaza, and what are the challenges that you've had to face as a diabetic, knowing that Gaza is closed right now and the siege?
Okay, thank you, Nihal. Okay, I don't know if you all know or not, but we've been under siege since 2007. So it's almost more than 13 years right now. And the situation itself in Gaza is hard. It is very hard, to be honest. And having diabetes would put more load into yourself and your family, your friends, and all your surroundings, of course. Living with diabetes in Gaza has like a kind of a whole shifting story to it, because I believe that the struggle we face in Gaza Strip reflects on us as like human beings and as people living with diabetes, to make us more mature when it comes to managing our diabetes. But it is very challenging. It is very hard. And we face a lot of problems, starting with the general situation in the Gaza Strip, the financial situation, the healthcare system itself. As like for me myself, I don't rely on the healthcare system at all for my medications and for my supplies. I do it myself. I buy everything by myself. The problem with the community, with the general knowledge about diabetes, when it comes to the stigma, the discrimination to people living with diabetes, we all face problems. We all face situations that we might get like end up I don't know, being very sad about. how people react of you being a diabetic or taking insulin injection outside. When we talk about the supplies themselves in Gaza, we don't have insulin pumps in Gaza. They're not like a lot of people can't afford them, of course, but they're not available in Gaza. I know like exactly 2 children in Gaza with diabetes with with pumps, and both of them don't use their pumps because they can't afford the maintenance, or they can't afford the pump every single month. So the financial situation is actually is very is a struggle to the diabetics in Gaza. We don't have sensors as well, so if I want to have any sensor, I would have to order them maybe from the West Bank, and this would of course cost a lot. So a lot of people with diabetes in the Gaza Strip don't use the sensors. This is simply my answer. Thank you, Nihal.
Thank you. Thank you. It sounds like it's quite a challenge. Thanks for highlighting that for us. So that my next question is, could you tell us a little bit about your participation in the Stanford Chronic Disease Self-Management Programs? Is there any particular story of empowerment that's been achieved through this program? If you could just explain a little bit of what your role was in implementing this program.
Okay. Thank you for the question, and of course, thank you, Kate, for the amazing program that you brought. I've seen in the invitation. Well, first of all, what like the first point that I wanted to say about the program is the teamwork that we had before the getting into the core and what we talked about and what we discussed during the program. It's like the first time since I was diagnosed with diabetes that I've seen like people work as a team regarding helping adolescents with diabetes. It used to be like me going to the endocrinologist, and this is the end of the story. I don't see anybody else. But now with the program that we're like implementing, I get to talk to my endocrinologist. I get to talk to a diabetic nurse. I get to talk to a therapist, to a dietitian. So to a team leaders as well, whom working with me. So the idea of working in a team is very helpful, is very relieving, and it helps people with diabetes manage their diabetes better, which is something we've seen throughout the program. The second thing is the core of the program, the discussions that we had throughout the whole throughout the sessions that we had. And I love the program because it focused on things that us in the Arab world don't talk about that much. When we talk about the psychosocial aspect of diabetes, when you talk about like your mental health, people in the Arab world or here in the Middle East don't talk about those things that much. It's only about what you eat. It's only about how much you exercise. So they don't focus on other factors that affect your diabetes. So participating in the program and being part of it, of course, helped us throughout our life. It helps us a lot to manage or to react better in situations, or in terms of being in stress or having any problem regarding those whole aspects as I mentioned. And yeah, this is kind of it. I believe that it helped a lot of people. Like for myself, like I had previous knowledge, of course. I'm a medical student, and like I started once I started med school. I gained more knowledge about diabetes. I started like it's kind of a new chapter of my life. So I wanted to know more about diabetes. So I knew a bit more about diabetes than maybe other leaders. So maybe that was a little bit difference between me and others. But I would say that it helped us a lot because nobody talks about those things here in this community. Nobody nobody says about how stress would affect your diabetes. Nobody would calculate insulin and get insulin because they're having stressful, let's say stressful events, or having a problem with, let's say, exams. Like I had a month Last month I had a very long month with exams. I had a lot of exams, so it was a stressful month, of course. And my diabetes, all of my blood glucose readings were, you know, kind of unstable. So nobody would talk about this in this community, or even endocrinologists here. But the program helped us manage situations like this, and get out of them in a better way.
Thank you. Thank you and you're right, the social cycle aspect of this program is one of the added benefits of working and using the Stanford Chronic Disease Self-Management. So thank you for highlighting that. So my next question is, how has COVID affected, how has COVID impacted your life, and how have you been able to adapt some of the skills that you've learned from the Stanford Prevention Program in your day-to-day life?
Okay. I would say that COVID impacted all of our lives kind of negatively. I don't like, being like in lockdown, being at home all the time, because I would feel lonely, of course. And I'm not that type of person who's always online, searching about things and watching videos. So it was tough, of course. And it might be like, on a bridge to depression somehow, or to being lonely. But the program, as you mentioned, as I mentioned, talks a lot about the psychosocial aspects and about your mental health. A lot of activities, a lot of things that we've done. So all of these things helped me. In particular, I'm talking about myself, of course, helped me a lot throughout lockdown, throughout being alone, and how to stay calm, and how to react in terms of how would lockdown itself affect my mental health. I didn't used to go out and talk to my family that much, because I'm not that much of a family person. But like reading more of the documents that we had for the program helped me to stay positive, to keep my blood glucose levels kind of stable, to know more how to exercise indoors, which is something we discussed. So yeah, I use a lot of techniques to help me throughout lockdown, and get my blood glucose levels better. And to be honest, my A1C is like almost 6.5 last time I checked it, and this is the best A1C I've had in years, to be honest.
That's great. Actually, that's great to hear. So I do want to let the audience know that when we started the program with Diabetes Palestine, it was in December of 2019 was when we began the program. And for the first 3 months, when they were initially starting, they were able to do some one-on-one sessions, implementing the Stanford Chronic Disease Program. And they touched on various different aspects around diet and exercise and mental health. And Gaza for a long time was actually COVID-free in the beginning, or very low COVID. And about, I think it was maybe 6 months ago, maybe sometime in May or June, the cases started to get higher, and Diabetes Palestine then started to move the program from face-to-face to WhatsApp. And I will go through some slides in a little bit. I can show you. So they adapted the program also. It wasn't like it stopped during COVID. Actually, most of our grantees in the West Bank did that. So they moved the programs over into the WhatsApp group, where they were, in each group, there was 25 participants with the two group leaders working with each group to go through the 6 sessions that the Stanford program has. And then they opened up the sessions for each other so that they had ongoing communications even after the sessions ended. So again, Diabetes Palestine did their due diligence and moved this program over to WhatsApp. So the program did not stop because of COVID. If anything, I think it helped many people, as Mohammed just said. So my last question, I think, before we go, because I know we are on time, is do you have anything else you'd like us to know about yourself or your family or the community? Or maybe give us a little brief, very brief summary of right now what the current COVID situation is like in Palestine, in Gaza?
Okay. Okay. If I want to say about the diabetes community itself, of course, like through lockdown, we couldn't be able to see a lot of friends and family members face to face, but using social media helped us a lot to get to know more diabetics from all around the world, which is something that helped me to get, kind of more having more of a positive mindset regarding diabetes, and had me thinking that like we as Palestinians, we grow up thinking that we are the kings of resilience, that we are resilient, but getting to know more diabetics from all around the world, sharing knowledge, gaining experience from everybody from all around the world, gets you to think or to know more about diabetes, and think that diabetics are resilient as well. And diabetics are the kings of resilience, as a matter of fact. So therefore, I'm happy to say, and I'm very proud to say that I'm a very proud and honored Gazan / Palestinian diabetic, which is something that I mix throughout every speech I give. That Palestinians and diabetics both are kings of resilience, and I'm very thankful. I'm very thankful for diabetes, to be honest, to give me such an opportunity to talk to people from all around the world, and yeah, this is
Thank
all I
you.
have. Thank you.
Thank you, Muhammad. You gave us a lot. Thank you so much. Stay safe out there.
I will. Thank you.
Norbert?
Slides for a minute?
Yeah, do you want to put them up for me, please?
Yep.
So right now, I will just go briefly over some of the organizations that we're doing, and it's a photo shoot, so a photo slideshow. Currently, we are funding Diabetes Palestine. This is actually not this is a photo. I just love this photo to put it on there. This is a counselor from Yes Theater, the group that that's doing drama therapy in Hebron. And actually this photo is taken in Susia. And Iman, the counselor, is just doing some warm-up exercises before she starts to do her where she will sit down with the beneficiaries and talk about a story impacting resilience and addressing some psychosocial issues. Anyways, this is my first slide because I love this photo. Can we go to the next photo? So this is pictures of Diabetes Palestine. If you see here, there's people coming in, because we do a measurable, we like to measure the results of our projects and the impact before the beneficiaries start. We ask them to do a pre-survey, which is a survey that is, I think was developed through the Chronic Disease Self-Management Program to assess the impact of the beneficiaries before and after. So they've come in, and some of them have been taking the test, and others are doing weigh-ins, and I think checking their blood sugars and going through some sort of medical assessment. And then there's a photo of someone providing training. And then these little WhatsApp messages are the group messages that are going around between the groups on a daily basis on WhatsApp. So this is Diabetes Palestine in Gaza. Can we go to the next slide? This is ABCC. This is Ehel Balata. They're also implementing the Stanford program in Nablus, in Balata in particular area. And here we have one of our amazing village health workers who is going through nutrition and teaching people about portions. And she also does a really great program about teaching them how to do exercising at home. Most women have either can't afford, or there's a cultural setback, I guess, I don't know, about women going to the gym. So that, but that's not an excuse. So we have village health workers in Nablus who are teaching women how to also do exercise at home, and they also do gatherings. This is obviously before COVID, where they would come together and do walks together and in and around Nablus area just to get the women moving. So that's ABCC. Next slide. And this is Caritas. This is another program that we funded a few years ago. We're not currently funding them. We finished the program with them, but this group was in Ramallah. We worked with them actually in certain areas in villages in East Ramallah. And there's some site visits that they do with the village health workers go out to people's homes and do health visits and make sure that their blood sugars are okay and that they're healthy and being checked on. And there's also sessions that they've done there. There's actually a few photos of Dr. Norbert, actually. They were the first group to be trained on the Stanford prevention program. Norbert has come out and actually trained every one of our grantees. They've had leaders. He's trained the leaders who in turn trained village health workers or community health workers in the area. So we have a huge training of trainers program, and Dr. Norbert is usually the one that's here and provides this training for everybody. So this was at Caritas. The next slide. This is Family Defense Society. They're also another amazing group. We just completed our 3-year funding with them. They are actually a women's shelter, and so it's actually the only women's shelter in the West Bank for women who are faced with domestic violence, whether it's a daughter or a woman, a married woman. And so they provide shelter and services for domestic violence, but they also received a fund from us to implement the Stanford program for women who are diabetic, who are obese. And so here are some more pictures and some village health workers here teaching women how to exercise at home and some healthy eating and some food. Another slide, next slide. This is also continued just exercising. I think this was where they spent a lot of time just teaching women to feel comfortable to exercise at home and, portion control with food. A lot of these women, all of them from all our groups actually have all reported back that because they became healthy and started to do portions and not necessarily diet, just learn how to eat healthier. It was the second beneficiaries around this, or the second tier beneficiaries was their families, because they, started to implement this in their homes, since most women do run the homes here. And so the families also started to get healthy. So that was a positive. Is there any other slide? I think that's is that the last slide? Yep, that's the last slide. So that's our program that we've been doing. So overall, we've had 4 West Bank and 3 West Bank and 1 Gaza group implementing this amazing program, teaching people how to live their best lives and their healthy lives. Thank you, Norbert.
Thank you, Nihad, and thank you, Mohammed. So to restate, the mission of Healing Across the Divides is to measurably improve the health through community-based interventions. You can start to get a little bit of the flavor of the small p political aspect of Healing Across the Divides. We're trying to improve the effectiveness and the efficiency of the community groups that we fund. And so it's very exciting to try to identify interventions that are validated, they're reliable, and translated and validated in Arabic. The reality is there's very few of those. And about 8 years ago, before I even started thinking about this, I was already quite familiar with Professor Kate Lorig's work at Stanford. And I, as a practicing internist, as Mohammed said, usually you do this one-on-one with a patient, in this case, myself as the physician. And what Kate has done is become really a world leader in how led chronic disease self-management. And I thought to myself, you know what? I'm going to become a trainer in that. And I went out to Stanford, spent a week, was fortunate enough, since I already knew Kate, that she invited me to beautiful home with lots and lots of dolls that some of you I'm sure have seen. And I became a master trainer. And that's the rest is history in terms of the West Bank. We're going to start doing this in Israel also. And we bring these groups together. So that's the other aspect of it. Whenever possible, whenever it's comfortable, we don't insist on it. We bring the groups together and they share stories. But we're really fortunate today to have Kate Lorig at the webinar, and she's going to give us some overarching background and really tell us what it's all about. There are a lot of questions I see. Not to worry, there's also a recording. But first of all, let me hand it over to Kate. Thank you so much for being with us today. And it's an honor to have you with us.
Thank you so very much. I am incredibly pleased to be here, to have so many new friends and old friends here. Norbert asked me to tell the story of how this all happened, and we don't have time for the whole story today, but I'll tell a little bit of it. It probably started with my birth. I have Gaucher's disease, which is a disease that comes when you're missing an enzyme. And so I basically lived with chronic illness my entire life. And I'm happy to see at least one other Gaucherian here today. And like a lot of people, I have very complicated feelings about Israel and Palestine and the place of both in our world. My feelings about suffering are not nearly as complicated. I think all of us need to do what we can and take whatever opportunities are offered. And this is an opportunity that was offered. But going back to my childhood a little bit, I was always interested in health, probably because I got dragged around to doctors a lot as a kid. And then as right out of university, I was one of the very early Peace Corps volunteers in Chile in Latin America. And what I learned in Chile is that healthcare systems can be built on the shoulders of people with very limited education. Because in Chile, most of the people in the healthcare systems below the level of doctor, nurse, midwife, are people with 8, 9, 10 years of education who are very skilled in a very small area. They run advanced first aid postas, they do vaccination programs, they hand instruments in surgery. And the system really worked very well. And I'd never thought about the fact that a lot of the jobs could be done in this way. So I basically saw lower educated people doing very important healthcare work. I also learned a whole lot about community, because community is much more than a place to live. In Chile, it's a place where everybody is very dependent on each other. And just a very short story, we lived in a house with very tall, unruly grass. Neighbor had a hungry cow. Hungry cow ate our grass. We got milk and everybody benefited. That's kind of the story of community. And I could give many, many, many others, but these were important things that I learned there. So I came back from Chile and ended up starting one of the first community health worker programs in the United States. And community health workers are pretty well established throughout our country now, but they were really an unknown factor in the 1970s. So again, I was able to begin to work with people with lesser education and find them a place in the healthcare system. Did that for a few years with both Latinx and Native Americans in this country, and finally came to realize that I really wanted to have much more impact on health policy. Went back to school, did a doctorate in public health and health education, and Stanford happened to have a job that would pay me enough money to get through school. And so I took this job putting together an arthritis program at Stanford, even though I had very little interest in arthritis. Little did I know that I would still be there 4 decades later. We put together a program, not too surprisingly, using peers to teach peers. There's not that many professionals in our country or any other country that know that much about arthritis. And thus was born the very first Stanford program, which are now SMRC programs. And from that came years of developing programs, doing evaluations, and then ultimately seeing if we could get other people to also do these programs. Now, when I went to Stanford, my great hope was that maybe someday somebody in San Francisco would do one of our programs. San Francisco is about 40 miles or 60 kilometers away. Little did I know that we would reach where we are today. Pre-COVID, we were giving programs to about 100,000 people a year in 30 countries. Post-COVID, some interesting things have happened, at least in parts of the world. We've moved a lot of our programs online. We also can give them using the telephone and mailed materials. And just saw the statistics the other day, we've given programs to about 7,000 people in the United States since March. So something that I didn't think was possible a year ago seems to be very possible. I'm not going to give you the details of the program today, except to say that they have some very basic principles. They're peers teaching peers. They're generally 2.5 hours a week for 6 weeks. And not only do they teach people about disease, that's easy. Anybody can do that. What's more important is that we give people the skills and confidence that they can live the 99% of the time that they have to live outside of direct healthcare systems. So we teach things like problem solving and decision making and how to make action plans. Action plans are making baby steps towards success, because what we really want our folks to do is succeed. We don't want them to be perfect. I am excited that Mohammed's A1C is so low, but if he had told me his A1C was a whole point higher, but it had started at 9 and it was now 8.5 or 8, that's not perfect, but it's an improvement, and that's what we're looking for. We're not looking for the ideal. We're looking for what's real for each individual. The other part of our program is that they're incredibly flexible. They seem to meet the needs of people across races, across ethnic groups, across religions, across language groups. A nice story, Norbert came to me and said, we want to do this in Palestine. And I said, well, training you is really easy. Getting the materials in Arabic is not so easy. So I put out kind of a call to all our folks around the world and said, do any of you have anything in Arabic? And I get this reply back from Toronto, Canada. Yeah, we have a manual in Arabic. We got it from the Swedes that had it translated by the Syrians. So the materials that are being used today in Palestine have seen their way around the world. And that's kind of the way this whole system works. It's a community too, and we try to help each other. I'm very excited that right now we are training our first person in the Soviet Union, and he will be training virtually with somebody from Canada who speaks Russian. So all things are possible today. It's been a great journey. I'm in awe of this today. There are people here from at least 4 countries, including somebody from Kerala, India, who we trained many years ago. I'm really pleased to see you, Sally. And the thing that we all have in common is that we are really committed to doing what we can in any way we can to relieve the suffering of chronic disease around the world. This webinar today is a picture kind of the global community. I have never met Mohammed. Someday I hope that we will be able to meet. I hope that we'll be able to be in communication after this webinar. If any of you would like to know more about the programs, or even if you're interested in taking them, no matter where you are in the world, let Norbert know, he'll let me know, and we'll be back in contact and we can tell you some more. because there's probably a program such as the one you've heard about today in Palestine that's near you. From the bottom of my heart, I really want to thank you all. Together, I think we can all move forward in baby steps. Thank you. Toda.
Thank you very much, Kate. It's really a joy to have you on. And I hope you're sort of getting the flavor of this amazing work that Kate has done. You know, hundreds of thousands of people that have been engaged. And I just want to highlight a comment that Dr. Ahmed Abu Al-Halawi made. He's the director of Diabetes Palestine. He's on the call. And actually, when you heard the conversation, when you heard Kate say how this, the Arabic version occurred, I was teaching it in English because I don't speak Arabic, and they had the Arabic version. So I was training the trainers, as I always do, and as Nihad pointed out. And I remember at one point, on the English language version, it was clear that it was particular within an English context. And I asked Dr. Ahmed, you know, how did it work in the translation? And the translation was really very culturally appropriate. So it's really, you know, so they worked with the Arabic version, I worked with the English version. And then, as you can see from Mohammed, the rest is history.
Can I just add, Norbert, one thing that I forgot, and that is that in case you're wondering, we're actually starting the program in Israel after the first of the year with another organization. So I just want to be very clear that healing across the divides really is healing across the divides.
Yeah, we were supposed to start, actually, I'm not even sure if you know this, Kate, with the one of the large health systems back in March. I had meetings set up where they wanted to implement it in Israel, separate, in addition to the organization that you and I are familiar with.
Yeah.
But then something came called COVID arrived. So what I'd like to do now is go through a couple of the questions before we get to the last part of the program. And those of you who know me know that I try to start on time and I certainly end on time. And I appreciate everybody's efforts. So here's a couple of the questions. I want to point out, Nihad pointed this out because Kate was remarking obviously how young Mohammed is. In the other programs where we've implemented the CDSMP, the average age is more like me, to make it simple, or maybe younger even, but not much younger. So it's really kind of middle-aged and older people. The one thing that Nihad, maybe I'll go to you for this if you want, for some of the other programs. How did they attract participants? You know, how did they enroll people in the program? How did the community-based groups, how did FDS, how did Caritas, how did ABBC enroll participants? Can you hear me, Nihad? Oh, I have to unmute her. Okay. Okay. Okay.
There you go. Hi.
Sorry about that.
So to your question, so ABCC worked closely with the Ministry of Health. Not in the beginning, they were sending out on their own, going to the village councils. And then once the Ministry of Health and Nablus found out that they were able to work with the Ministry of Health through the village councils to get the message out. So they were visiting small villages, sending out a little message of the program. And so that was how, and that is currently how ABCC in Nablus is doing it. FDS did the same thing. They were most of this work is done on a grassroots level, which is with the village health worker, with the village councils and the village health centers. And FDS also at some point was able to work with the Ministry of Health. Caritas has a clinic itself in East Jerusalem in Aboud, which is one of the clinics that they have there. So they would do announcements through the clinics there, and that's how they were able to get their participants. And in Gaza, the same thing. In Gaza, actually, I don't know if Mohammed can answer that one. How did you guys get participants in the group, or Ahmed, or actually Mohammed in Gaza? If you're on mute.
Okay, thank you. Well, we tried as much as we can to call every single participant through a database that we collected individually from a lot of NGOs around the city. So we contacted every single participant and his family individually to tell them about the program, what we're doing, and to invite them into the first session where we met and introduced the program to them. They
Okay.
loved the idea, and of course, they continued throughout the whole sessions.
So also with the other groups, just to add, a lot of it was also word of mouth. Once one group started, other people would hear about it and want to join, and so that was another way. But there was a call through the village health, to the village councils. That's how it started, and then soon after, the Ministry of Health was helping sign up people and turning people to go to ABC or FDS to join the program.
Just want to point out, which I'm sure you've already observed, is that one of the main objectives as a side objective. So first of all, we want to see measurable improvement on health, and we've already talked about that. And you've seen it, in action, and you know that it's evidence-based. Secondly, as part of that, I've said sort of broadly speaking that we're trying to empower and increase the effectiveness of the community groups that we've served. And you just heard from Nihad. So what we don't make the connection between, for example, ourselves, themselves, and ABBC and the Ministry of Health. We certainly encourage it, and the Ministry of Health sees some benefit from themselves of working with ABBC, and that increases the status of this community-based group. And then lastly, of course, you've heard from Mohammed, it almost brings tears to my eyes to see literally the hundreds and thousands of individuals that Nihad and I and Marganit Ophir Gutler, who's our amazing Israel representative who's on the webinar today, they work directly with the leaders who in turn work with people, leaders like Mohammed, and then people, Mohammed, that in turn works with many others. So that's sort of what again, I just want to emphasize the small p political benefit of these efforts. I want to ask Mohammed a question that came up, and it comes from Ariana Toomey. And let's see, I'm going to unmute you. Or I'm going to try to unmute you. Okay. Yeah. So the question is, do you have any tips or suggestions on how to lead education efforts virtually when the participants don't have reliable access to phone data or internet, which I'm sure must be an issue for some people, some of the diabetics in Gaza, for sure. So would you like to make a comment on that in terms of the use of WhatsApp and things like that?
Okay, for this issue, there were some people who were, who could not join us on WhatsApp groups, who had internet issues, and therefore we delayed them to the groups that we're starting very soon, face to face. So we worked on delaying them. For people, of course, we're working with very young ages, so a lot of them don't have phones. So we're working to set it, like for example, for the WhatsApp groups, whenever we want to talk about a session or whatever we want to talk about some specific topics, we worked on setting an exact date and hour. So we would start the session and tell every single parent of those participants to join us and talk to us, and of course get their children or adolescents to join as well and talk to us throughout the text, throughout voice messages. So we ensure as much as we can for them to interact of everything what we were talking about. So we don't want to be only talking, giving information. We wanted the sessions to be interactive as much as possible, especially in terms of using WhatsApp. A lot of people sometimes won't give any attention to the messages you sent. So we tried as much as possible to make it interactive, to find video, to make video calls, to send voice messages, to ask them to do something, to do some tasks, and then send us some feedbacks or send us any reply that could answer our questions. So this is almost everything that we've done so far. Of course, we tried as much as we can to avoid any internet problem, especially internet problem, through making people with bad internet connections in groups where we're going to start very soon peer-to-peer.
Thank you. There's some other messages, and let's take a look. If there are any other questions, so feel free. If there are any other last questions, feel free. What I'd like to do now is to just give you an update as to where Healing Across the Divides is at, and then I want to introduce one of our board members. So, as I'm sure you know, with the COVID pandemic, there are many different challenges that that people have. But one of the things that we have to do is to live within our means. So we currently are funding 6 different grantees. I gave the example, for example, of the urban farm. But we can do the work that we do with the fact that we have this amazing board of directors. And on the board of directors of this American 501c3 are Jewish Americans, Arab Americans, and then Americans who are interested in health, Americans who are interested in human rights, and Americans who are interested in the Middle East. And we welcome your interest. So in terms of last words, and I'm going to see if I can get myself technically capable. I'm going to see if I can unmute Heba. Are you on? Okay. Let's take a look once more.
Did that work?
It did. It did.
Okay, great.
So Heba Al-Zawahri is one of our board members. She's a health professional living in the DC area. We have board members from throughout the United States. I see some of the board members on the line, including Candida Quinn, who's from Montana, and Karen Meadows from Maryland. And others, and I just want to welcome Heba for some last words, and then I'll say a couple last words about the next webinar. And welcome, Heba.
Hi, so my name is Heba El-Zawari. I'm a family physician geriatrician in the Washington, D.C. metro area. And I've been with Healing Across the Divides for a little over a year now. And I just kind of wanted to share a little bit about what draws me to Healing Across the Divide. And so like what the name says, it heals across the divide. So it acknowledges that there is a divide within the region, but it has nothing to do with the conflict. It's not political at all. And if you kind of look at the world the way I do, we're all strung from the same thread. So helping any community, you're helping your own community. And that's what appeals to me with Healing Across the Divide. And as far as me being a healthcare professional, I love that it reaches out to the non-communicable diseases, which are the highest cause of death within the world. So diseases like diabetes and chronic disease and mental health, working for the people who are disenfranchised on both sides of the borders, helping them find self-reliance and overcoming their obstacles. So that's really what appeals to me. And lastly, I have to mention that the founder, Norbert, his passion is also what draws me. And he is easily accessible. He is never discouraged, and it's very admirable. So if you have any questions, you can always reach out to him, no matter who you are. And that's what I love about Healing Across the Divides.
Thank you for those more than generous comments. So if there are any last questions, feel free. There's a question about the COVID vaccine, whether it will be available to those with chronic illnesses in the West Bank and Gaza. Nihad, do you want to make any comments on that? Have you heard about that?
About the vaccine, right?
Yes.
We are, I heard the Russians are giving us a vaccine. That's the one that, so we don't know how true or not that is. There's just talk right now. We know that Israel is moving towards, I heard recently that they've bought vaccines from Pfizer, and Moderna. So, you know, it's we are across the divides, but even in Israel and in Palestine, there is a health issue. And so whatever they get, hopefully we'll be getting soon after. So in terms of what we're going to get, I don't know yet. But the situation here in the West Bank, cases are, it's, you know, winter, fall, cases are growing in the West Bank. Deaths are growing, and we're just all kind of waiting to see what will happen. Things are open for now, but there's talk that in the coming weeks that we will be under another lockdown in the West Bank. And I think Gaza has started already a lockdown. And so we're just waiting. We're hoping that, you know, we'll be a part of the groups that get the vaccine. I wanted to say one last thing though, around before we go with Diabetes Palestine in Gaza. And I don't know if we made this clear, that the beneficiaries in Gaza in particular are actually youth, ages 12 to I think to 20. And everywhere else in the West Bank, our average age is about 35, going up to 65. But the one in Gaza is particular because it's type 1 diabetes, not type 2, and there's different types of diabetes. So in Gaza, that's who our target audience is. It's the younger children with their families also. So I just wanted to point that out.
Thank you. Thank you, Nihad. I would just say a couple comments. One pertaining to the vaccine. There are many divides, and the situation is getting more challenging in terms of bringing groups together. Last year, to make it simple, the Israeli military wouldn't allow Palestinian groups that were funding to get together with Israeli groups in East Jerusalem. So that's getting more challenging. But at the end of the day, as Heba said, I'm not easily discouraged. In fact, I'm never discouraged. We just have to.
Norbert,
Oh, there you go.
Yeah, it's in Israel's interest to have as healthy a population from a communicable disease perspective. And I would have to be optimistic that once it becomes generally available, that there will be a vaccine. My last comment is I just want to say really two things. Number one, that on December 13th, you will all get a notice about this. We will have a focus on 2 new books that are coming out early next year, all delayed by COVID. The first is by yours truly. It's on peace building through women's health. It'll be published.
Norbert seems to be having problems with his connection, and I'm not exactly sure what he was going to say, but he does have 2 new books coming out. I'm sure he'll be happy to send you all information about them. But it's about his work and about how we can have better equity in healthcare.
Yes, and we will be having, I think, a webinar talking about those in sometime in December. I'm not sure the date around that, but that's the plan, and I think that's what he was trying to introduce.
Can you hear me now, by any chance?
Yeah, there you go.
Okay, so the date is December 13th.
Oh, there it is.
And that'll be with Len Rubenstein, who just authored a book that's coming out on attacks on healthcare professionals, which unfortunately is occurring more and more often, who used to be a board member, and then a book of mine on peace building through health in the Israeli-Palestinian conflict that will be focused. You'll all get a notice of it. I want to thank each and every one of you for being with us today. It's truly an honor and a pleasure to see many of you who I know and to meet many of you. And I hope looking forward to not just doing the Zoom, which is okay, but I'd rather meet all of you physically, please. And I think it'll happen sooner rather than later, but I hope you got a feeling of what one organization is doing from the bottom up, from the ground up, to measurably improve health and over the long term to address one of the longest lasting conflicts in the world today. So again, thank you so much to everybody, and we will speak. Bye-bye now.
Bye. Bye, everybody. Take care. Thank you.